for 2015 is officially underway. We are now under being recorded. This meeting. So welcome everyone to the statewide CDSMP collaborative monthly meeting as we wrap up another year. That's pretty amazing. And a nice full agenda. We're excited to put another session. So I am going to call out names as I see them on my list. If I don't, and if you would just introduce yourself and who you're representing, so that our guests can also meet you. And I am going to start with our guest speaker, Sally Thorson. I see her name on the webinar, but I don't know that she has audio. Sally, are you there? Hello? Okay, she may be having some difficulties. Let me go ahead and go down the list. Monica?
Hi, this is Monica with Region 8, South Central Colorado Seniors area.
All right, great. I'm checking my emails in case Sally sends me a note. Is Allison Newman there?
Yes, I am. I'm Allison Newman. I am a community health educator with UC Health Northern Colorado, working on fall prevention and chronic disease self-management.
Well, welcome, Allison. Do you work with Ellen?
I do, yes. She couldn't make it today, so I am stepping in.
Oh, awesome. Great. Okay. Then you'll really enjoy hearing Sally's presentation.
Yes, I'm looking forward to it.
Yeah. Whitney.
Yes, I'm here. I am from Weld County Area Agency on Aging, and I do our wellness program.
Great. Connie?
Yes, hi, Connie Young. I'm with the State Department of Human Services Division of Aging and Adult Services, and I've been managing our federal grant, which we are wrapping up some of the small amount of funding this year.
Great. And then there's myself, of course, Mary Gallus. I'm Director of Implementation for COA, the Consortium for Older Adult Wellness, and chairing this collaborative. Assumingly this is my last day, however, I did get an email asking if needed to go into January, so I am willing to extend one more month. But looking forward to someone else being able to step into this role and taking this on and really developing leadership skills in other folks in our collaborative and you know, sharing that fun. So we are certainly going to remain active as a member, but looking forward to someone else sharing the collaborative. I hear laughter. All right.
That might be in the background from where I am. Sorry.
Oh, okay.
If it is, it's 2 cubes away, so it's volume on my end must be really good.
All right. And then also we have with us Kelly. Hi, Kelly Jackson. I'm a coordinator at COA, and I am taking minutes. Thank you. Anyone else? It looks like maybe Greg has come on.
Yes, I am on.
You want to introduce yourself and your role?
Yeah, absolutely. I'm Greg Smith. I am. I work for Aging and Adult Services here at the state. I am Connie's supervisor, and that's my role.
Great. And Sally, she might have stepped out. Sally, are you on yet?
I'm on the phone. Is that working?
Yes, we can hear you. Are you
okay,
not?
Great.
Are you not?
I am seeing it. I tried to go on. Some reason my microphone through my computer doesn't seem to work, but I can see the screen and I can be on the phone, so it's working.
Perfect. Would you introduce yourself then, and maybe
sure.
get into detail later? But
okay, I'm Sally Thorson. I work for the State Health Department in the injury prevention area, and I'm particularly interested in older adult fall prevention. So I've been working on a couple grants to coordinate getting evidence-based older adult fall prevention classes going. I know I've worked with Allison on that. And so I'm just going to talk later about the successes we have and see a great connection between what you all are doing in chronic disease self-management.
Absolutely, yeah, we're looking forward to that. Anyone else that I missed that might not be showing on my screen?
Mary Pat, it's Melissa.
Okay, great. Melissa, are you on the phone?
I am on the phone, and I'm going to be on and off of mobile, so I'm going to put myself on mute so I don't make any extra noise.
Okay. Would you just quickly introduce yourself then?
Oh, yes, I'm sorry. Melissa Pruitt from Boulder County Area Agency on Aging.
Okay, and you actually oversee fall prevention too, don't you, Melissa?
Yes, I do. Yeah, we do both.
Right. Sally will be of interest to many of us. All right, so on our agenda, if this thing goes on. Okay, there we go. So we're going to have Connie start with some SUA updates. Then we'll have Sally come in at hopefully around 9:30 and share with us. And she's got a slide set. And then we'll wrap up with some training announcements and some future agenda suggestions. So with that, I'm going to let Connie go ahead and move us along.
Thanks, Mary Pat. So can everyone hear me okay?
Yep.
Yes.
How would you respond if you couldn't, you know? Okay, so if you have any trouble, don't hear anything, then shout out. Let's see, so first thing is some good news, update on data collection, and this is all the forms that you all have been submitting to the Colorado Department of Public Health and Environment doing the grant so that they could enter all of that data into the NCOA, which is National Council on Aging database. I had emailed all of you a couple times to ask about continuing that function of collecting the data and uploading the data. I heard from most people that at a minimum they're willing to continue collecting the data. I didn't hear anyone say they weren't. And I had asked about who'd be willing to help upload that. And the good news is that Lindsay McIntosh told me yesterday that COA would be willing to handle that function statewide. So that's a big relief and a big contribution that will be made to us here in Colorado. So I have to work with NCOA and COA to coordinate all that needs to be done in order to make that happen. So I wouldn't suggest sending data to COA yet, those forms to COA yet. You could either hold on to them if that's something you can do, or if you want to keep sending them to CDPHE, that's fine too. And then, excuse me, once we get all that finalized, I'll send out an email to Mary Pat to send to all of you, hopefully in the next couple of weeks, since I did tell CDPHE we'd try to work that out in December. But I do want to thank COA for stepping up and offering to do that.
You're welcome.
Any comments, questions?
So just so I'm clear, this is Mary Pat. The I think a month or so ago we were instructed to go ahead and finish sending them through this year to Lori, or not. I know we're holding a right now.
Well, we didn't have I didn't have a specific cutoff. I just had told CDPHE we'd work it out by December. So I'll does it matter if it's specifically the end of December, or, I mean, would that be easier to just say through the end of December and then starting in January we'll work that out for you?
I think that just seems like a clean cut as far as
okay.
that goes. You know, I know we're sitting on some that we can go ahead now and send to her. I feel, I just feel like maybe that's just a good way to start with January 2016.
Sure. To be honest, I don't know if they've been entering all that data. I'll need to check with Lori about that because my primary focus was figuring out what we do in the future. So let me check with them about that, and then, but yeah, let's do that. Just either send them to CDPHE like you have been, or you can hold on to them until we, well, actually, if we're doing what Mary Pat said, just go ahead and send them to CDPHE as you have been through the end of December. And then in the meantime, I'll talk to them about whether they've been uploading all that up to now. And then we'll shift gears in January to COA.
Okay, good. And Connie, if Lori hasn't and she wants to send that to us and we finish out 2015, that's okay.
Okay.
You know, just so you know, I mean, obviously I think we all want to see, you know, the total of 2015, and I don't want it to be sitting on a desk if that's a holdup.
Sure.
So, okay.
Okay. Thank you. I appreciate that.
Sure.
The other quick thing is that Mary Pat and I will be on a webinar next week with the organization Health Links. We've talked about that some before, and it's an employer, I don't know if it really is association, but it's housed within the Colorado School of Public Health, which is a part of the University of Colorado out in at the Anschutz campus. And what they're doing is working with employers around the state to certify their wellness programs. So as we discussed before, it's a way to acknowledge what they're doing to beef up their employee wellness programs and provide a credential to them for what they're doing. And as part of that, they've invited us to be to submit information to them, to publicize what we're doing through the chronic disease self-management program and all the other courses that are part of that suite of classes. So Mary Pat and I will be on a webinar next week to share information about chronic disease, its impact on the workforce, and how this program can hopefully help with that. I wasn't able to get a response back yet from them about whether you all could call in. If you can, I'll send that information to Mary Pat, and she could send that out to everyone if you're interested in listening in. But I also wanted to ask, and I don't know if this will apply to too many people on the phone, but I wanted to ask who among you wants to be listed as a resource for them. COA has COA has a lot of the former license holders under their license now, so they would be covered. And some of you can't serve younger individuals, and as employees, the majority would be under 60. So I don't know if any of you on the line want to be, maybe Allison, want to be listed as a resource for providing classes to employers. And their reach is statewide. They're not working, I don't think they're working in every city and every community in the state, but that is definitely a possibility. So does anybody who's on the line want to be identified in our PowerPoint as a source to contact for classes?
Connie, this is Melissa.
Go ahead.
And I'm just wondering, is there opportunity for reimbursement for those programs? Because that really changes what our, what we're able to do.
Yeah, that's what we're hoping for. That's why we're making this presentation to start out. I think I had talked with Lindsay or Mary Pat at COA about their possibility of providing some classes or support for individual employees to begin with, but it's not meant to be a long-term, their funding of those individuals is not meant to be long-term. So that would be our, getting reimbursement for those classes would be our long-term goal. So given that, if you were reimbursed by them, are you able to serve? You're still only able to serve under 60, right? Or are you thinking that this is a different kind of aspect of your business?
I mean, I think we're looking at how to be able to do, you know, more combinations of work, and we've been working with COA on that, so I'm certainly open to learning more. We can't use our Older American dollars, obviously, for that, but there may be some more creative ways to do it. So if that's the case, then yes, we'd like to be listed. If it's just set in stone that they're only going to, that they're not going to reimburse, then, you know, probably we shouldn't be on there.
Okay. Yeah, I have to figure out how to do that since, yeah. Well, if you're working with COA, maybe that would, so, you know, one of the items on my agenda here is to talk about partnerships among license holders, if we get to that today, but that was one idea of those of you who only can serve older adults, potentially partnering with COA, who can serve other ages, to team up and be able to offer to provide classes to all ages. So, you know, that is something that we're working toward. I guess what we could, you know, Mary Pat and I will talk about how to message that in terms of how to pay for this in the future, and you know, maybe I'll touch base with you afterward about, you know, whether to list you or not on that. But I appreciate your interest in knowing that that's a possibility for you.
If I might just add a comment on this, if I'm not mistaken, Connie, and correct me if I'm wrong, but as far as reimbursement, I don't believe there's direct reimbursement coming from Health Links. What I believe is, yeah, it would be an exposure through them to these different employers, and then you would develop a partnership with that employer who may choose to reimburse for that expense or pay you. Like we have had that experience with City of Lakewood. So we did get funds from the Employee Wellness Program and that budget to provide classes to their employees. And that's
correct.
So just in somewhat in answering to Melissa's question, yeah, there's potential, like Connie said, but it's something then you have to go and, you know, work with that particular employer who gets word of us through Health Links. Does that sound right?
Yes. Sorry if that. I assume people understood that, but thanks for clarifying that. And that's also something that I can work with Health Links to. I have talked with their staff already, the people that I've been referred to already, about, you know, long-term funding, but through the employers that we don't have the grant anymore to offer as many free spots as we did in the past, or any really through the grant. So, you know, that's a big question now is, you know, if you're telling us about this, how do we access it? And the answer is that at some point you have to pay, unless they're, you know, people that you all can serve, you know, older, 16 older, who you get some funding for. So yes, again, that's the incentive is for the employers, and I have a lot of good information about that I've gathered about the incidence of chronic disease among workers, really among the population, but the data showed percentage of people that have at least one chronic condition and more than one. So I think it'll help illustrate the fact that their employees, whether they know it or not, have health issues that could impact them on the job. So hopefully there's an incentive to them to support them in managing that so that they can stay on the job and be effective while they're there. So that is the long-term hope. It's part of my effort to try to help sustain the program long-term on a statewide basis.
Yeah, absolutely. I'm excited to see it happening, and I would bet you there are some other license holders who may be able to take advantage of it. I'm thinking of Secahak or Colorado, CU North. You know, you guys might have some opportunity too, or CU Health, I guess I should say, to tap into something like that. African American.
Yeah, and yeah, nobody from the Center for African American Health is on the line, right?
I don't see anybody, no.
Okay. I know that Glenda had mentioned possibly being interested. So what about, Allison, do you know at this point, should we list you all as a potential option, or because you serve all?
Yeah, potentially the enhanced wellness and the living well. I know we can do younger than 60, but besides that, I do more of the fall prevention, so that would be a question for Ellen with the chronic self-management information.
Could you follow up with her and ask her to give me a call or send me an email?
Absolutely.
Okay, great, thanks. All right. The two other things I have on the list, well, let's see, 6 minutes. Which could we try to do? I guess since we started talking about the options for partnering with other license holders, this might be a longer discussion, but it's something that's come up a couple times, as I just mentioned, that the possibility of teaming up with COA so that you could offer to serve all ages is something that I think might really help market the program, so that if you're going to a health facility or a medical practice, they're not wanting, unless they serve only older adults, it would be a much more positive approach to be able to say we could serve all your patients. So and I don't know, there might be opportunities. I think you all have paired up in some locations to offer a class that crosses geographic boundaries in order to, be able to recruit more people. I guess, do you all have any thoughts about that right now, about your ability to do that, or whether you'd like to talk more, individually with COA or a license holder who covers similar areas, or do you want to have another discussion on the next call?
Well, I'm going to interject here because Melissa and I have talked about sharing on the next call in January.
Oh, yeah, that's right. Good.
Yeah, about our practice of doing that, which has worked really well, and we both agreed that, yeah, we'd love to do that next time. So maybe this is a good way to just sort of put that subject out there. But people can put together some questions they might have or examples they may have for the next meeting, and kind of
that sounds good.
Step. Yeah, and we'll certainly be happy to give a little 10-minute opening or whatever it takes. Melissa, that's correct, right? I hope she's still on the phone. But
yes, that's correct.
don't leave me out there stranded.
Sorry,
yeah, thanks.
My gloved hand is not hitting the controls very well.
Thanks for that reminder, Mary Pat. I know we had talked about that, and I'd forgotten that we had talked about doing that in December. But yeah, that would be great. Maybe we can do a reminder to people about that before the next call, so that people know, hey, if you're interested in this, please make sure you're on the call.
Yeah, and I'd love to have other examples. That would be great. So
I can share briefly, and we might want to, maybe we could talk about this last issue again another time. But one issue that had been brought up by one of the physicians that participated in our webinar with Telegen, and that, as you may remember, was a webinar for physicians who are involved with Telegen, which is Meredith's organization, the Quality Improvement Organization for Medicare in Colorado. One of those physicians said his challenge is figuring out how to keep people engaged and still meeting those action plans or doing action plans and continuing to manage their condition after class. And this isn't the whole answer. Did want to have a discussion among everybody, but just to give you a little bit of information about what I got from NCOA, they said that some states make their class completers aware of other evidence-based programs in their area so they can continue participating in other healthy activities and have the social benefits that come from being part of a group. So I think this would not just be the Stanford programs, but other opportunities that they're aware of to kind of keep that momentum going. So that's something from the organizational perspective. They also said that sometimes completers individually, or informally, decide to keep meeting for lunch or coffee, or doing walking groups that help them stay involved physically. The third thing that I talked about before is for people who are able to or comfortable using computers and internet and all of that kind of thing. There's the online community available to anyone who's taken one of the classes, and I've given that information out before, the link for people to go to, and really hope that your instructors would provide that information to people. Let's see, this is they also mentioned, the organization offering to provide space for participants, like to come back to the same spot, meet regularly, monthly, quarterly, bi-monthly, just as another opportunity. And most of those are more participant directed so that it wouldn't require involvement from staff and that additional time commitment. But there are a lot of different ways of doing that, and they just mentioned that those as ones that they were aware of that other states had done, or that have been done in other states. So I wanted to pass those on as options for you to consider. Should we put this, sorry?
Connie, this is Meredith from Telegen. I just also wanted to add that we actually in November was our first outreach to the participants that have graduated our classes. On the 6th and final class, we're asking them if they'd like to receive continuing tips and tricks, recipes, healthcare information, and if they're wanting that, then we put them on our contact list and send out emails to them. And so we've started that. Anyone, that's open to anyone. So I'd be glad to talk further about, if you all would be interested in accessing that outgoing information and getting people on our list. We can do that in the future. The other thing that we're really considering how we can spread this practice is physicians have the opportunity to provide group visits for patients with chronic conditions. And so it really would work out great if, for one example, we have a practice down in Colorado Springs that we're doing classes for, that if when they graduate from the classes, then they fed into that group visit structure. That would be another great way to keep them engaged together. So those are a few of the things that we're also working on in the background.
That's great, Meredith. Just a quick question. Are those group visits eligible for Medicare reimbursement?
They are. And,
okay.
And there's plenty of rules and structure around that, as you can imagine, but that's something that we can help practices with, wade through that and see how they can bill Medicare for those services. So.
Great. I'm wondering if maybe what we could do, because those are great ideas, and there aren't, there's not everybody's on the call. Maybe what we could do is put together some ideas for license holders to get out to their class leaders about here are some options and resources and ideas for people after the class, so that they wouldn't have to remember these and they'd have something that they could hand out.
I think that's a great idea.
Okay. All right. Well, let's. Mary Pat, can we put this on the agenda for next time, and then we'll come back to that. And then the last thing I had was that I didn't mention to Mary Pat, but because Mary Pat said that COA is ready to turn over the reins for the collaborative, I wanted to touch base or see if anyone anyone who's on the call has an interest in looking at that as being the chair of the meetings and taking care of meeting summaries and that sort of thing, so that we could try to have a decision by January on who can do that. Is anyone on the call who might consider doing that or learning more about what's required? Everyone must have their phones on mute, because I'm not here.
Why did all the signs light up? Oh dear. Well,
it is a time commitment, that's for sure. But maybe what we'll do in the meantime is send out an email just asking people about that, since everyone's not on the call. And but anyway, okay, that's it for me, Mary Pat. Thanks.
great. Yeah.
And if I could,
Sally, go ahead.
Yeah, and I wanted to just say briefly that I have met Sally last March, or we had talked in last March and met at the conference in DC, which is a joint conference of the chronic disease self-management programs and the Falls programs. And Sally's a very humble person, and she has done, every time she talks about what she's done, because I had to get some of this information for a presentation I made in DC, I've just been really impressed with the successes that they've had. They've had two different falls prevention grants, and I know she's trying to do more, and that's great. But she's also done a lot already, and not everything will fit what we're doing, but I invited Sally to share her successes with us, because I think we can learn from some of those and see if any of those will work for you all. So that's my plug for Sally. And Mary Pat, you might have some other things you wanted to say.
Thank you, Connie. No, that was a great introduction, and I'll kind of let Sally explain a little more about the role and what she's done, but I would agree we've and I know some of you on the phone also work with Sally, so she's somebody we really enjoy working with. She does have a great personality. It's easy to work with her. I was just in her town yesterday in Grand Junction, which is where she actually resides. It's hard to believe how she gets all around the state from Grand Junction, but let's let Sally go ahead and speak. And Sally, I am going to ask if you would prefer, I can turn the screen over to you, and then you can navigate through your slides, or do you want me to stop?
Oh, if we can try that. See if I can handle that technology.
Okay.
Too. So just walk me through how I take it over. Thank you for those introductions. I know when you're working on a program, you always can see where your successes are and where you have the challenges, and so sometimes I know I kind of focus on the challenges rather than, hey, these are really some good things. So hopefully these tips will help you.
Well,
maybe not, huh?
Here we go. Change presenter to Sally.
Okay.
Did you get it?
Yeah. So I show my screen. Will that? Do I need to pull up the presentation myself then?
No, it's not. It should have been the next slide. There you go.
Okay. Okay. Let me see if I can.
And then just make that all screen. Yeah.
Okay.
There you go.
All right, great.
Everybody seeing it?
Yeah, I can see it. This is Whitney.
Okay. Okay. So there's great ways that our programs obviously overlap. The background is that my branch, and it has an incredibly long name, Violence and Injury Prevention Mental Health Promotion Branch at CDPHE. And we have two cooperative agreements, one a 5-year project with CDC and one with the Administration for Community Living, which is a 2-year project, and they're both ending around the same time in 2016. And of course, like everybody else, then we'll look for additional funding. And our goals were to significantly increase the number of older adults who participate in these specific evidence-based community programs that work to reduce falls. And we're monitoring hospitalization rates as one way to look at our outcomes, which is a tough thing to do because you have to have enough reach to get enough older adults to see that reduction in hospitalization rates. But that's a goal. And the second, which is kind of, actually new to some of the projects we've worked on, but not new to CDSMP, is sustainability, engaging the healthcare providers and getting them to do referrals, and securing innovative and sustainable funding arrangements to support the programs. I know I've worked for the health department for a long time, and what we tended to do was to get money and then put out mini grants or give community grants out to develop these programs, and we always talk about sustainability, but the reality is, because people have the money, they work really hard and do great programs, and then when they stop having the money, they really have no way to continue the program. So we really worked hard on this project to say we're not giving out funds to implement programs, we're giving out support only, and we've got to find ways to embed the programs. So let me see if I can, not sure I'm advancing. I don't see that I'm advancing the slides here.
Yeah, I'm not.
Might have to.
Unless you hand it back over to me. Or I take it back over, I should say.
Yeah, I'm not. Oh, there. Okay. Press enough buttons, something works.
Okay.
So what we tried to do is our ideas for the programs were to embed these programs within existing organizations. So for Stepping On, it was to embed the programs within the hospital trauma centers and other partners. And so we worked on maintaining the relationships with the trauma centers and other partners to do that and recruit more hospitals to develop that partnership. So for example, if we contacted a hospital and said, a lot of other trauma centers are using Stepping On, here's what the program involves. It's a lot like Matter of Balance, if you're familiar with that one. It's 7 weeks of classes, 2-hour classes once a week. And it's getting people to figure out how to solve their own, identify their own fall risks and solve those problems. And there's exercising involved at each of the classes and home exercising. And it's really to get people motivated and solving problems. So it's really chronic disease self-management for fall prevention. So if hospitals said, well, we don't have the staff, we don't, then we just say, we're going to have to move on to another facility because we don't have the ability to pay you to do this program. But we had a lot of trauma centers who were interested in doing that. So now I'll talk a little bit more about that. And then also the Tai Chi Movement for Better Balance is one Tai Chi class that's evidence-based for fall prevention. There's another group, Tai Chi for Arthritis group, that's also evidence-based, but we were charged with bringing this new class. And that was to develop relationships with Parks and Rec. So we started out kind of cold calling. This is a great class. We can provide the training for free. We'd love to have you add it to your list of classes. And if they were willing and able to do that, we could send them to the training for free. And I guess I didn't explain this. Our ACL grant, which we're just starting the second year of that grant. That was to extend what we're doing in Denver Metro to the rest of the state because the CDC grant really wanted us to concentrate in a high population area. So that's how we kind of divided up the work. And again, that was asking them, not paying them to run the classes, but to use the fee structure they had or figure out how they could make use of Silver Sneakers, memberships, anything they could do to get that going. And, some places said yes, others said, no, we can't do it under those arrangements. And then we're working on those arrangements with health benefit programs, and that is the one that we're still really working on. We can, working with the area agencies who have Title III dollars as a way to help cover some of these programs. and looking at cost sharing, but that's the part we haven't quite figured out. So how we were able to do this is trauma nurse coordinators. Those are the nurses in the ED that have that particular job. Each hospital has a trauma nurse coordinator. In the large hospitals, it's their full-time job. In smaller hospitals, it's just one of their duties. But it is a distinct job that every trauma center, which means every hospital, has to have. So we've had ongoing relationships with them through the health department work, our injured community planning group, through our EMS and trauma section. And so as we've talked over the years about injury prevention, they got that idea but really wanted an evidence-based package program that they could get behind. And Centura and Health One are two of the, I think they have the most hospitals between the two of them. And at those large hospitals, Swedish and St. Anthony, they have even more of a charge, since they're larger hospitals, larger level of care, to really work on injury prevention. And so they were able to take the leadership to say, we want to do fall prevention programs. Thanks for making those available. And they could find the time and the resources. And some of it was just through the hospital systems helping each other figure out how to do that. And so with that, you had to have the administrative buy-in. So Centura and Health One administration said, yes, this is important to us. You need to, we'll support you in you're doing the fall prevention classes, which means they have to cover salaries for when the nurses are teaching the programs, and we have to have guest experts, so that means physical therapists have to be at some of the sessions, and that means they have to find a way to cover their salaries and supplies, and hospitals have really good marketing departments. So that's how it's worked. So what we kind of did is say, we'll get you started. Training is free. We can help pay mileage to wherever the training location is. We can give you $999 maximum to get your kit together to start classes, and then, we'll help you in however we can in figuring out how to get that going in your hospital. And not all hospitals have been able to follow through on it. You lose some control and ability to really push these programs through quickly when you're embedding them rather than providing them additional funding. So what's the challenges then are getting enough of the programs and getting people of all different ages and race, ethnicity, that kind of thing in the classes. But it is really sustainable in that if our project went away, like say tomorrow, I have a lot of confidence that most of these stepping on programs would keep on going. But it is hard to sustain, any project. Something else will come along and people may feel like, oh, now here's a new program on, obesity in older adults, and if we do that, we can't do stepping on, so, let's move on to the next program. So it's always hard to keep that sustainability. And you have to figure out what's in it for the hospitals. And the hospitals may say, well, we need it to prove this, and we can't always provide the data that they want to see. So I won't have time for questions, so I'm just going to move through these. But the same thing as embedding Tai Chi Movement for Better Balance. The ways that it's worked is getting potential instructors enthusiastic. If we get them to the training, we know our Tai Chi Movement for Better Balance trainer, it will impart that enthusiasm and provide ongoing support just by having somebody to ask questions of, having refresher classes, that kind of thing. And really emphasizing that the skills they need are not Tai Chi masters, but to understand the movements and how they help in fall prevention. And then show that other agencies are able to do that. So once we got the first kind of core of Parks and Rec going, then we could say, we'll look at what they're able to do at this location. And again, administrative buy-in, the supervisors have to want to put the classes into the schedule. And so I think it's a good model to have that all set up. You know, if you come to training, you must sign a memorandum of understanding and you must agree to do this many classes in this time period. And I think that's a good model, but we kind of chose to be a little more liberal on that. In some cases, people would come, instructors would take the class not actually knowing if their location would run the class, but they got really enthusiastic about it and came back and talked to the wellness coordinator and could make a better pitch for it internally because they knew about the class. So that's one way that we've done it. And we've given administrative buy-in. We've tried things like having wellness coordinators through like Colorado Parks and Rec Association or specific standalone meetings to really reinforce that their demographics are changing. They need to be thinking about how they're going to serve older adults. This is really a gateway program to getting older adults who haven't been exercising interested in doing more and how they can fit it in with other senior programming. And again, the challenge is really instructors for Parks and Rec don't get paid a lot of money, and they usually have to pay for their own training, which so any amount of money is expensive for them. Some of them get paid by their agencies, but a lot don't. And we emphasize fidelity to fall prevention, so this is not a program that you can just, oh, I'll throw in a little Tai Chi in my Silver Sneakers class. It's really needs to be a commitment to the fidelity, which you all understand. And again, sustainability, you know, now the next big program is this, so we're going to drop Tai Chi, but to understand it's more of a core program. And I put competition in quotes because some Tai Chi people can be very passionate about Tai Chi and the form of Tai Chi that they teach. And whereas any Tai Chi is probably going to be helpful with balance, we're really trying to get them to make a commitment to the 12-week, twice-a-week class. And this is not just, you know, one more fitness program. It's a specifically for results of fall prevention and how they can weave that in there, and to provide them data that reinforces that. So we've worked with other locations. Some health departments are doing Stepping On. AAAs, some of them, like in Weld County, actually run classes. Others of them have been doing cost sharing, which when the AAA didn't want to fund a whole program, they are doing some relationships like, we'll help identify clients for you that would be good for your hospital-based or community-based program, and might be able to provide some funding to help with the program. So it's really a cost sharing, which some of the AAAs have appreciated when they didn't have, you know, obviously those Title 3D dollars get stretched in a lot of different ways. And we're really trying to work with independent living facilities to run programs there. And a couple of the ways we're looking at doing that is the Flex and Silver and Fit, where Flex is a Silver Sneakers program where instructors get entered into the system and then they can teach outside of gyms and rec centers. Flex is not reimbursable in those locations where they already have Silver Sneakers. And it's the compensation level is a challenge because the good part is the Healthways Flex people will pay the instructors directly, but the compensation they get is difficult for independent instructors to make enough money on for it to be worth their while. But we really want to work on that more. And referrals from providers, we're looking at those things like keeping the cost of the consumers low, so the hospital Stepping On classes are usually free. We're looking at that Medicare billing code, so could we use that as a way to get these programs reimbursed? CMS is currently doing a study with using nationwide, but using some of our stepping on classes to get people to agree to give, be part of the study and give out their claims access so that CMS can look at those people who've taken stepping on and compare them to people, control group of the same sort of people but who haven't taken it, and see is the claims data decreasing. So we're part of that study. And then that really cost-efficient referral network. I was kind of actually amazed when I went to that meeting that Connie mentioned, is that a lot of places want to put a lot of time and effort into that referral network, and I understand the beauty of that and the value of that, but it takes so much money to develop that network, and I keep thinking in my mind, if we could just give that money to instructors or locations to give classes, then would we get more out of that? But that's because I know we can't find the funding at the state health department level to provide that kind of referral network, and we're working on doing that only on a small scale. So I have a couple of infograms that the Stepping On Hospital said they really like this, which talked to them about that they could show to their administration on here's who we're seeing. So it's good information. It also tells you the group's ethnicity and males and things that we're not reaching as well as we could. And also using one of our mobility tests, the timed up and go, which is meaningful to a lot of physical therapists and hospital people, that we're really, even in a short 7-week class, moving people into a lower risk for falls category. And the Tai Chi also providing this kind of information back to the Parks and Rec is helpful for them to see what are the benefits. People would recommend it. They talk to their doctor. They get confidence, focus, balance, stability, more activity. They move out of the at-risk category. So trying to figure out different ways to provide the data. And the successes are having those relationships and using influential groups that we already know about, being really clear on our purpose and the benefits. Tai Chi works for a lot of different age groups and also for other chronic diseases. And then the hardest part, I think, as a health agency has been looking at what hospitals care about and why they would agree to keep this as part of their organizations. What instructors care about, making that difference one person at a time, which is a good goal, but the population health and the population results have to be there in order to sustain the programs. And I think the hardest part is just figuring out the healthcare providers themselves, the doctors or nurse practitioners, for them to, make a referral or is hard enough, but then to be involved in that, having programs at their agencies, the healthcare providers just may not see a return for their investment. So if a practice was saying, we'll pay for this class, which would be a great thing, it's, figuring out how that money they pay out gets them, that they're able to continue to make money in their business model. And that's been more difficult for us to kind of break into. There's some evidence about fall prevention programs save lives and save money, and this is a good infographic about it. The difficulty I always have with these is that when you're talking to someone like a hospital and you say Stepping On has 134 net benefit for participants, 64% return on investment, the hospital said, well, how is that going to work at our individual hospital? So these sort of global savings figures don't always resonate with individual hospitals. And that this is my contact information, my supervisor, Lindsay Myers. And then we have a new person, Anna Pergola, who just started Tuesday, and she'll be helping with a lot of the evidence-based programs, and she's a certified Tai Chi Moving for Better Balance instructor, has taught a lot. So she'll be helping us, so some of you might hear from her at some point. So that's what I have, and available to answer any questions.
Sally, this is Mary Pat, and one of the last comments you made I thought was interesting for all of us to maybe be aware of, if I understand. You said that on the hospitals, you have this global data just like we have national data from Stanford, but they actually are looking maybe more for local data that impacts them directly with their service area perhaps, or something. Is that correct?
Yeah, I'm starting to hear that as, you know, they've been supportive, hospital administration, of the trauma centers being involved in Stepping On, and they like the infographic. And now they're coming back and saying, you know, this is great, we are happy that you're doing this, but we want to know that we've reduced, you know, what's the benefit to the hospital? What have we reduced? And, you know, we're not collecting necessarily that kind of data to be able to say, you know, it's hard to prove that you've prevented a fall. You have to do large studies. So we're looking at trying to figure out how we can provide more information or give them a structure so they could say, you know, we've given this class to 30 people. If the national data say that that reduces one fall, that saves this amount of money, which each hospital could determine what that cost is. So, you know, what they ask us is prove that it saves, you know, St. Anthony Hospital money, or that it's worth us putting the X amount of money into it. And that's, you know, that's just difficult to prove, but I think we plan to look at that really directly and see, can we give them something that helps them continue to want to support the classes. I mean,
right.
You know, you know, most of, you know, we're not marketing it to people who've fallen, who go to the emergency room and have already fallen. I mean, that would be one way to do it, and then we could see that they don't come back because they, you know, we're looking at what are their unreimbursable costs, you know, readmissions for falls, those kinds of things. But in some ways, we need to get the hospitals to realize, oh, these programs would address those areas. So.
Yeah, this is Connie, and we've had that issue come up, maybe not quite at that specific level, but maybe because we didn't ask the question, but through the interviews that our consultant did when they're developing our sustainability report, that people, you know, we say, well, there's data from national level from Stanford about how people say it impacts them, but they say, well, we want to see that in Colorado, and then, you know, the cost is one thing, and then you're saying it's not just in Colorado, but in my facility. And it makes sense to me that, if I understood you correctly, that you're trying to give them or come up with a way for them to evaluate that, because I know from our perspective, we'd never be able to run many research studies in every place where this exists, but for them to track, you know, I mean, I don't know if they would do this, but it's, like you said, have to be a control group of people with similar characteristics, and then the experimental group, so to speak, that have been through your program, and see what the differences are. Is that kind of what you're thinking, Sally, when you mention a structure for them?
Well, I think that is, you know, if the hospitals want to apply for those types of grants, they certainly could do it. They have the expertise and the people to do that, but that is, you know, a lot of money and a lot of time. I'm thinking more that how can we give them or help them with ideas like, for example, St. Anthony is participating in the Stepping On part of the CMS study. And I think that's going to be helpful just to say, when we get that data, it includes Colorado information. We won't be able to pull out just the Colorado stuff. But I think we're looking at those ways of, what is the hospital, how can they quantify what they're putting into it money-wise? And are they seeing a decrease in admissions? Are they seeing, some other ways to look at what they get out of it? We do surveys, we have data collection, and our federal people want us to collect data and ask these particular questions. And I'm always sort of in that conflict of what our funders want us to give them back as data isn't necessarily the data that our stakeholders want to see. So it's always that kind of conflict there on, the stakeholders may want to see that the TUG tests improve. And our federal funders said, you don't need to do TUG tests because we're not collecting that information. So we have to figure out ways to collect the TUG test information, somewhat separately. And, because you have to give the funder the data that they asked for, but what are the specific things that are meaningful? And we came up with this idea of the TUG, which is a mobility test, is that, you can say the average score was this at the beginning, the average score is this at the end, and that's a statistically significant difference. Well, our stakeholders, the trauma nurses said, what does that really mean for us? That's great, is a half a second per person a good goal? What does that mean? So we looked at it and said, there's a way you can use that score to develop risk for older adults for falling. And if the score is more than 12, they're at high risk for falling. So we looked at, and some people come into the class that are doing really well on that test. So, but we want to get those people who aren't doing it well. So we have, our epidemiologists could look at those people who came in at risk for falls having very high scores. Took them a long time to do this test. So how many of them moved into the lower risk group? So we're looking at, that statistic should be more meaningful. So that we're trying to, that really involves going to those stakeholders and saying, this is the data we're collecting, we can give this back to you. If there's something else you need to use to prove, then you have to figure out a way to collect that information.
Yeah, it's a challenge. It sounds like you're being as responsive as you can. It's kind of sitting here thinking, it's kind of interesting. It's like, do they track all the other things that are more medically sanctioned, to see, well, what's the result of this intervention? I don't know about that, but it does seem like the more we could show them how to give them tools for some of the reimbursement that's available. On that Telligent webinar, Devin Detweiler from Telligent talked about a Medicare code that can be used not to fund a whole class, but to fund some of the initial evaluation, and I'm not going to do a good job of describing that, but anything that somebody can use to provide some funding would be, seems like that would help. But
so there needs to be that somehow, what is the outcome that, CMS obviously needs to see, does this class reduce healthcare costs? And that's going to be what motivates them. But until we get to that point, until they've done all the studies, and I really applaud them for really looking and starting to do those studies. But doctors look at other things, like they'll monitor blood pressure numbers and say that's a measure we can look at. So TUG could be one test. It's not a perfect test. That could be an outcome measure. that they appreciate. We also, we've really tried to get these classes up and running and get people motivated to go to the classes and things. And when we ask them, were you referred by a doctor or a healthcare person, we're only getting like 12% of the people say yes. So most of our success in getting people in these programs is not from the healthcare referrals. So we also ask them, are you more comfortable talking with your doctor now? And they say yes, and I think that information might be meaningful too. And are there ways to get them to then go back to their doctor and say, oh, look, here, I took this class. Here's the, here's the piece of paper they gave me that show my results. We don't have that kind of funding to do these, huge push to change healthcare providers' ways of doing business with falls. So we're sort of looking at the, ways, how can we do the motivations and things on the level of funding that we have.
Yeah. Well, just briefly, I was thinking about the webinar that I was referring to that we did through Tallagen, and the 3 physicians that were on the line who presented were very positive and persuasive about, at least I thought they were very persuasive about why they have supported this program, and they don't have data to cite either, and of course data is very helpful. And I can understand the need for it, but they were, giving their own sort of testimonials about how this was helpful for people, why they got on board. And one of the docs was a slightly older guy who, not that old, but said that when he went through medical school, there wasn't any discussion of this kind of thing, and initially he was kind of resistant to it, but got on board when he saw the results from patients. So, I mean, that helps too, but because it doesn't reach that bottom line as if it's saving us money or not, but it's one other aspect of selling the program. But
yeah, I think the testimonials, a lot of like exercise instructors or the nurses at the trauma centers, anyone who teaches these classes, and I know all of you who teach these classes, can tell these great stories of, you won't believe what Emma did, or I really saw this, and they're very compelling and can help get other people there. And so I think sometimes I forget that the physicians are going to, can appreciate testimonials as well, but we're trying to figure out, if we could generate the older adult talking to their doctor and saying, I took this class and it was really good, here's what I learned. If we can get that discussion going, then the doctor might be able to say, wow, that's great. Now I can kind of see how I could maybe refer other patients. And I think, the other way to go is to try to get those doctors in a room and show them the statistics and all of that, and say, will you sign up to refer 50% of your older adult patients to our program? That's what we'd like to see. I just have to figure out which way to get, that to go. And I think working with physicians and healthcare providers, takes a lot of funding and, time to work out those angles. And are there other more subtle ways we can do it, I guess, as well, sort of working from top down, reaching the physicians, but also working from the patients up to their doctors, and we have to do both.
Good suggestion.
Were there other comments, questions for Sally?
I have kind of a question to folks on the line. Are these, as I mentioned before, I think Sally's done a really great job with getting some really key organizations and entities on board to support the classes. and I'm hoping that we all, or some of you, can see how this might apply to you. But I'm wondering if you think it does, if these give you ideas that you might want to pursue, and then if so, what would you need to do that? So kind of your take on how this applies to you.
I have a question. This is Whitney. Sally, have you seen anyone create any sort of a form or a letter or anything that is sent back to doctors with results, similar to how some of the programs do with our CDSMP program, that allows the participant to the doctor? Have we seen that done at all?
Actually, I came up with a form and got some input from some of the Tai Chi form that could be used like that. It just seemed like it was we didn't have the ability to do it in kind of a formal way where, people filled it out, gave their doctor, we faxed it to them, and then we could follow up with them, kind of a thing. Because, I find on forms people put down their doctor is Dr. Peterson, and it's actually Dr. Peters, and, they don't have the phone number with them. So trying to get that permission and all that. So trying to do it in a kind of a formal way where we could go back and check up on it and say, Dr. Peters, 6 of your patients went to this class. It was really good. Can we talk to you about how to do that more? That would be, that would be great, but we just didn't have the ability to do that. But we do have a form that we have asked if instructors wanted to use it, but haven't at this point had the ability to go back and say, did your people use this? And, because, that's the other part. If somebody takes the Tai Chi class and at the last class, here's your TUG scores pre and post, here's a little interpretation of that, write down a few notes and then share this with your doctor. Those people are sort of lost to follow-up now.
Right,
you
right.
Don't
yeah,
know.
Participants ask if they want to know their results, but I doubt it's getting back any farther than that. But
yeah.
Again, I mean,
right.
too, but,
right. So, it would have to be, that's the kind of thing. If the hospital, I'm just trying to make things sustainable. That means that we can't control all of the data collection and feedback. So, stepping on folks, or even Tai Chi folks, you have the list of people and have the contacts with those people. So if you wanted to, Whitney, talk to, follow up with each of your people who took a class and said, did you go back and give this form to your doctor? How did that go? And that's probably not something most Parks and Rec would be able to do, because that's just not their abilities. But, if we're for stepping on programs where the trauma nurses are collecting that information, that's, possibility. But the hospital would have to say, I could see the value in collecting this information. And they have to take some ownership, to do that, rather than just say, oh, you provide us the data. And so, that's where we have to get to those, to that point. And that's why, if doctors were referring to the programs, they could ask for some feedback,
Yeah. Could you email me that form? Because we're getting ready in January to start a non-traditional class in kind of a facility type setting, which the doctors would be more contained. You know what I mean? And I don't really know what would come of it, but I might want to give some feedback to them, and that might be a good template for me.
Yeah. Okay, sure. Thanks.
Thank you.
Well, if I could just ask again if anyone on the line knows Monica, Whitney, Allison, Melissa, and it looks like Samantha is on the line too, whether any of the ideas that Sally presented are things that you might like to look at pursuing in your areas, and if so, what assistance, if any, would you need to do that? Does anybody have any thoughts about that right now?
This is Allison, and we do the Stepping On program in one of the Tai Chi classes through COA, and I think they're really well attended. We actually have been doing like a 6-month follow-up with our Stepping On classes, and we ask them questions about, have you followed up with a healthcare provider? Are you still doing the exercises? And we do still get really good responses. About 30% of the participants do say that they have followed up with their healthcare provider, just going back to that last question that you had. So.
Okay, great, okay. Thanks. What I was also thinking is of the ideas that Sally presented for her falls prevention, I'm hoping that a lot of these, at least some of these, would apply to CDSMP. And are some of you interested in pursuing those strategies to sustain CDSMP programs in your area?
Well, this is Mary Pat. I think it's always good to get new ideas and learn from others who are doing well at it. Like Sally, ideas and techniques. We're so happy that you are sharing that with us, and even that we have now webinar information and access to you as we move ahead. But yeah, I mean, I think it's always good to hear from other resources and folks, especially in our state, and the challenges that she's faced, and then some of the successes that she's had is
mm-hmm.
I was thinking when she was talking about the national funders versus the local data, that conflict. I thought that was really interesting, and I was thinking how we've had to tweak. I know at COA we've taken that form, the NCOA demographics form, and had to add a cover page, and I think others might be doing that to gather additional information. I know intelligence does that. I know we do that, and probably others that locally is needed versus just what a national form has, produced. So I thought that was really good to hear. It was very in line with what we've kind of experienced as well. And then we'll go to a partner who wants even to answer, 2 more questions or something. So it's nice to hear that we're kind of in agreement on that. It's a challenge.
Yeah. Well, one thought I had, just as a suggestion or question to you all, is I know that working with the medical community may be a little bit more time-consuming, and there may be multi-approaches and discussions in that, which is really valuable. But in terms of ease of pursuit, it seems like looking at options for offering the classes through Parks and Recs, through community education. I know some universities offer community education classes of a wide range of topics. Might be something that would be fairly easy to pursue, and of course there's the marketing involved, but if it's a class that's listed on and somebody sees it, that they're interested in taking it, and you have people to lead the class, it could be a way of getting some revenue in from the paid people, while then you provide the classes that are supported with your own funding, whether that's through the AAA or another organization, but a way to expand the reach and get some paying members of the classes. So I don't know if anybody's interested in thinking about pursuing that or not, but I really like that idea, and like I said, it seems like something that'd be easy to test the waters with. Any comments on that?
This is Whitney. I can tell you from our perspective, we've seen a lot of fluidity between our fall prevention program participants and locations and our CDSMP participants and locations. So for example, we were working with the rec center in Fort Lupton on a matter of balance class, and they said they wanted more classes, and so we've moved into doing DSMP there, and then we're planning a CDSMP next year. And they want, you know, the active classes like the Tai Chi too, but they all, I mean, once you get that captive audience, all of these programs are things that they want to see, for sure.
Yeah. So there's some crossover, at least in the target populations.
Yeah, and this is Sally too. In the, you know, we look at also people, obviously, that are going to fall prevention classes are over 65 generally. The chronic conditions, like 61% of them said they have arthritis, and this is stepping on and Tai Chi thrown in there together. And, you know, heart disease, 20%, vision problems, 10%, you know, like, and they have, like, about 46% of them have multiple conditions. So it's the same group. I also heard another, one Tai Chi class given by a hospital. The EMS providers wanted to talk to older adults about using CPR, or actually those AED machines for bringing back heart if somebody's having a heart attack. And so they said, well, you can come in and talk with our Tai Chi Movement for Better Balance class, because that's exactly the right group. And so they were able to, you know, use that same group and help support them. They didn't have to find their own group of older adults. So that's one way I'm trying to think now of how to get EMS providers more involved in, you know, helping support these kinds of classes, because they could come in after a session or something like that, and you know, perhaps they have some outreach money or something like that that could be combined with it, but getting them to see a connection that works for them.
This is Melissa. I was gonna echo what Whitney had to say about, you know, it is nice to sort of cross-promote the programs once you have one, and usually Matter of Balance seems to be the easier one to recruit for. Then you at least have some people to go to about the chronic disease class. The other thing that's happened here, which has been helpful, but I don't know that there's any follow-up afterwards, but at the physicians clinics that we work with through Boulder Community, they have a packet that they put together for people that they identify as falls risk, and it includes a little brochure I did about tips for how to prevent falls, and also our flyer for Matter of Balance with, you know, my information so people can call about that, and that has certainly led to some referrals. But I don't know that anybody looks at it after they go to the class and what the doctor, you know, if the doctor follows up with them.
Well, this has been good discussion. I know we're getting close to about 5 minutes remaining this morning, but any other questions, especially for Sally? This has been a good discussion, Sally. Thank you so much.
Thanks.
I'll also just put another reminder in that this webinar is posted on our selfmanagementcolorado.org site. So if anyone wants to go back and reference any of Sally's slides or listen to the information, it's forever available on our website, as well as, of course, Kelly is dutifully taking minutes too. So if you want to share it with a colleague who missed this or refer someone else to hear her talk, then that's available to you as follow-up.
This is Sally. Can you just tell me how many CDSMP license holders are there in the state? Do you guys know that right off the top of your head, or is it, you know, like 12, 20, 10?
That's a really good question. I would say roughly right now, and Connie, I mean, we have some that have recently let their license go because of decisions and choices, but whatever. I think we're probably around 8 to 10 right now that are active.
Okay. Yeah, that sounds about right. I think we had close to 15 at one point, and
Yes.
some are not participating anymore, and some are going under COA's license but still are active. So
Okay.
there's been some shrinkage, but
Okay.
some of it has just been, you know, people are still active but under COA.
Okay, thanks.
Sure. We didn't have a Q&A for Sally to ask, did we? Sorry. So,
I know how to reach you, Mary Pat.
You do know how to reach me. That's the other thing I was thinking later that I forgot to say is that Sally has a great sense of humor, a really good wit. I always appreciate that in folks. So, Sally, I'm going to take over the slideshow.
Okay.
Just so you know, we only have a
All
couple.
right.
But I'm going to do that right now. We're going to go back to me. Okay. All right. So I'm going to fast forward through her slides. I love those infographics. Those are great.
Yeah, it was. I had a goal to try and figure out how to do those, and then I just was kind of surprised that people liked them. I guess shouldn't be a surprise. We see them all the time.
Yeah, it's the new marketing tool.
Mm-hmm.
All right. So
yeah, my participants love those.
yeah, I think they're really powerful, and I think you have some great examples. So I'm just going to reiterate the statewide trainings that are coming up, and that SecHec did add one. Some of you may not know. It is posted on the Self-Management Colorado website, but they do have one coming up very soon. December 4th.
Hey, Mary Pat, I'm not seeing the information. Is it just me? Are other people seeing the slides?
Let me just see here.
I don't see them.
There we go. That's good. Thank you.
Okay. I have one more button I needed to push. Okay, is that good? So,
yes.
Statewide training. So, SecHec down in Pueblo is doing a CDSMP 4-day training, the 14th through the 17th. Crystal wanted to be sure we shared that with the collaborative, and it is on the website. And certainly you could contact Crystal for more information. And then we've got one coming up. COA is doing one then in January here locally in the Denver area, and 25th through the 28th, and then that is followed by a diabetes cross training. And that's all I posted for now. Unless anyone else has anything else to share on any kind of training they have coming. Okay. So our last slide is about future agenda. We talked about sharing about partnerships next month. Our meeting is January 7th, 2016. We probably want to have some discussion about the role of the collaborative as we move ahead and make sure that we sort of have some goal and direction as far as what we want, if we're kind of in review maybe, as well as projecting ahead what we'd like to see, maybe set some strategic action steps, so to speak. It's been suggested, how do you handle outside resource materials at your class? I think that would be a good discussion topic. We had put on for the next agenda, and Connie has mentioned it today, about supporting participants after the workshop ends. So I don't know, maybe we can pull that one off. We weren't sure we'd have time today for it. And then maybe some additional discussion and sharing on how you handle difficult participants. I know we all went through the training, and there's a nice, resource material in our leader manuals, but I think it's always helpful as we all are out there conducting these workshops, how maybe we've had some difficult situations and how we've handled it. It's always helpful to hear from each other. So that was all I had. Again, if you have other ideas, please don't hesitate to email them to me over the next 30 days, because January 7th is my last time. And I just thank you all for allowing us to lead this and share this collaborative. It's definitely something we see a lot of value in, and COA will certainly remain as an active member each month. But again, I'm just putting that shout out for someone to step up as a leader chairing this collaborative. But we certainly don't want to see it go away, and we want to be active as much as anyone else. Any other comments, thoughts? If not, I'm going to close the phone call and stop recording, and I want to wish everyone a happy holiday season, happy New Year. A lot will happen between now and when we meet again. So take care, everyone.
Thanks, Rupa.
Thank you.